Type of test for SARS-CoV-2 infection can be divided into three. Number one is nucleic acid amplification testing, or PCR, or polymerase chain reaction. And number two is antigen detection by various methods. And number three is antibody detection by various methods. Alright, so we have two classifications of tests. One is virus detection, and the second one, the detection of host response, which is the detection of antibodies. So in terms of virus detection, we have two classification of testing by NAT, or nucleic acid amplification test, and also antigen tests. And talking about the samples, okay, for virus detection, the required sample is respiratory samples, which is the nasopharyngeal swab, oropharyngeal swab, as well as the lower respiratory tract samples like sputum and also bronchoalveolar lavage, whereby testing for the host response, host immune response, detection of IgM and also IgG. Now people are exploring IgA is by blood sample or serology. About the timing of the detection. So virus detection, we can early detect the virus at the early stage of infection. Okay? For example, nucleic acid testing or PCR, during incubation period, there is a low sensitivity, but when there is established infection, the accuracy is very high, 95% and above. In comparing to RTK antigen, okay, incubation period detection is almost zero. However, detection during established infection, the accuracy is high. And for the host immune response, timing should be later in illness, after day 7 onwards. Then IgM start to rise. IgG start to rise by day 10 onwards or during recovery. So this is a simple briefing or explanation on types of tests or SARS-CoV.